Hello, my name is Berenice Daniels and I'm the Director for Inclusive and Specialised Education Support in the Western Cape Province of South Africa. I'm going to speak to you about my role as a Provincial Manager in supporting inclusive education in the Western Cape and share with you some of the challenges that I faced in this role. As the Manager, I have the responsibility broadly to coordinate the rollout of inclusive education policy as contained in our Education White Paper 6 on special needs education. This includes overseeing the management of special schools and their transformation into special school resource centres. I also facilitate the transformation of ordinary schools into full service or inclusive schools and manage the provision of specialised support services. The aim is to increase the capacity of the system to address barriers to learning and to become more inclusive, to foster intersectoral partnerships that enhance and support inclusion. My work includes liaising with various role players such as officials in the education department, other relevant government departments, other intersectoral role players, school governing bodies, and parents. As although our unit drives the implementation of inclusive education, a whole system change is required, and so we cannot effect that on our own. Where I work in the Western Cape Education Department, there are different specialised support services. These include psychological, social work, learning support, behaviour support, therapeutic services, and then we also have teacher or class assistants that work in our schools. All of these provide support to children with disabilities and other barriers to learning. I also work with special schools, who both provide high-level support to children enrolled at these schools and to children needing support in ordinary schools. These special schools are incrementally being converted into special school resource centres to better support children and teachers in ordinary schools. In our province, the special school resource centres have been strengthened by providing them with outreach teams. These teams are either specialist teams or generic teams. Specialist teams include teams for autism spectrum disorder, specific learning disability, and for children with severe and profound disabilities who are in special care centres. The generic teams provide support to ordinary schools that are being converted into full service or inclusive schools. The idea is to take the support to the learner wherever possible, rather than taking the learner to the support. However, this is currently not always possible. While we build capacity in the system, sometimes where learners have high level of support needs and require scarce specialist expertise, they need to be taken to the support. Accessing support is usually done via the Screening, Identification, Assessment and Support pathway, also known as CIAS, which you will have heard about. When the CIAS documents are filled in properly, they provide very useful background information, particularly for the district-based support team, about the learner's challenges but also strengths, what has already been done, which helps to inform decisions about the kind and level of additional support the learner may need. The Integrated School Health Policy assists us in getting support from other government departments, primarily health and social development. The challenges for me as manager of the service is that the majority of teachers in the system have had little or no exposure in the pre-service teacher training to inclusive education or how to address barriers to learning. This means we have to do a great deal of in-service training. When it comes to training, there are also other education units who do training of teachers, particularly the curriculum sections. Our education system in this country is very focused on academic results, so the curriculum training often gets prioritized above other training needs. This means that it requires constant advocacy within the education department to get opportunities to do teacher training on inclusion. Including learners with special education needs or disabilities has been rejected by some, as it is felt that this might lower academic results and sometimes is actively resisted. Where schools have successfully included, it has resulted in positive attitudinal changes for all the learners in the school. And these are the examples that I bring to the attention of those who are skeptical about inclusion, believing that these children do not matter that much. Similarly, advocacy is needed in getting posts provided for the various support functions. When sufficient human resources have not been made available, the staff has worked long hours and made personal sacrifices to ensure that programs for learners who are vulnerable stay on track and are not discontinued. Another issue that we face is inflexible curricula and assessment, which create barriers to learning. Also, lack of early intervention causes backlogs, which result in higher levels of support being needed. The huge migration into the country and the province also puts a real strain on scarce resources. This situation will hopefully improve as inclusive education is implemented elsewhere, with the necessary training and resources provided, of course. What I have seen that improves the service and what we should continue to do is to collaborate with other stakeholders and also have more forums with officials, teachers, learners and parents to spread and discuss the message of inclusive education. After many meetings with the Provincial Department of Health, we have developed a joint integrated school health policy, for example. Last year, about 50,000 grade 1 learners were screened for sensory and other physical impairments and received interventions. We have seen pockets of very good practice in schools and have started good practice workshops which are hosted by the schools. Our very first workshop, hosted by one of the full-service inclusive schools, was on the topic of inclusivity at no cost, which gave ideas about how to make or use things that cost nothing or very little, which would support inclusion. We need to be constantly on the lookout for good practice and spread this good practice. We expect so much from our teachers, who often work in very difficult circumstances. Care and support for teachers and learners is critical, and so we need to increase health and wellness promotion activities for teachers who are our most important resource. With our national pilot field testing full-service school in Tafelsig, Mitchells Plain, we first had to listen to teachers talk about their daily stress and struggles in this often dangerous area with high levels of gang violence before we could begin with inclusive education workshops. Our officials are also affected through having to deal with continuous trauma, and so we have to find ways to support them. We are also aware of intersecting vulnerabilities for children with disabilities, which may include disability, poverty, living in a rural area, and being at a school where there is poor quality of teacher preparation. These often result in education exclusion. The Care and Support for Teaching and Learning Framework, also known as CASTLE, has been adopted by the South African Development Community countries. The framework provides a model for strengthening education systems by mainstreaming support. This can contribute to all children and youth in the SADC region realizing their right to education. But it depends on multi-sectoral collaboration to enhance the provision of services in a complementary way. At national, provincial and district level, the Education Department can provide an enabling environment for other stakeholders to provide support in a coordinated way. In this way, schools become inclusive centers of care and support for teaching and learning. In my position as Provincial Director of Inclusive and Specialized Education Support, I have endeavored to do this. As the National Commission on Special Needs and National Commission on Support Services, of which I was one of the coordinators, we listened to the voices of people with disabilities, the parents, the teachers, the academics, and the public at large. The combined report, which led to the Education White Paper 6, is thus a consensus report based on those collective contributions. As part of that process and finding myself after that in a district which piloted the recommendations, and now being in the provincial department and participating in national committees, there's an opportunity to facilitate the transition from policy to practice. It's not always easy, but so worth doing to enable the desired inclusive South African society.